Does your heart change with age, and what can one do to help reduce the risk of heart disease? Dr. Rajneesh.
Yeah, Divya, lots of changes occur in our body as we age. So it also happens with blood vessels and the heart. So what happens, the lining of the blood vessels become very stiff as we age, and the walls of the heart, they also become thick and stiff. Now this stiffness of the blood vessels lead to high blood pressures, and the thickening of the heart wall lead to decreased compliance of the heart. So heart is not relaxing properly, and that leads to a lot of strain on the heart. And these two phenomena, the increased blood pressure and the increased thickness of the heart walls, lead to lots of heart failure events. The heart failure events are like, the patient is complaining of breathing distress, even at rest, or more so on lying down. So these events increase with aging population because of these two things. Now, very importantly, these things can be reversed to quite an extent if we maintain a very good lifestyle, very good disciplined lifestyle, which includes a controlled diet, which includes a disciplined exercise routine. So then we can actually reverse these stiffness of blood vessels and the thickening of heart walls to quite an extent, and obviate many of such events which are happening with aging.
Can a heart attack cause cardiac arrest? Dr. Kapoor.
To understand these both things, heart attack as well as cardiac arrest, they are very dangerous. Cardiac arrest is more ominous, I would say, because it's practically a stoppage of heartbeat. The heart has totally stopped and it's not going to give us more time. So if the patient who's having a cardiac arrest is not attended within minutes, we lose a life. So that is where what you were talking initially, a cardiopulmonary resuscitation, the value of CPR holds maximum in a patient who has sustained a cardiac arrest. Now, heart attack happens, as my colleagues are also narrating, because of blockage of the artery which is supplying the blood flow to the heart muscle. So if those arteries get occluded, the blood flow is stopped to the heart muscle, and that is a heart attack. Now, heart attacks, whenever they are massive, they can lead to a lot of electrical disturbance in the heart and can lead to cardiac arrest. So heart attack can be a reason for cardiac arrest, but 90% of the heart attacks, usually they give some time for the patient to reach a hospital. And in a patient who's actually going through a heart attack, the first 4 to 6 hours is most valuable, as if we open the culprit artery which is occluded, whereby the blood flow has been stopped to the heart muscle because of that occlusion. If that artery is opened well in time, then a lot of heart muscle can be salvaged and a life can be saved, or the quality of life can be maintained of that patient. But then it should be in initial 4 to 6 hours, where we call this period as a golden period.
Right. So how important is it that people whose relatives suffer from heart disease learn CPR? Dr. Rajneesh Kapoor.
Yes. So, Divya, this is very, very important to make everybody understand who's actually going through this program, that CPR is one very important technique which everybody should know about it, in the public, in the family, or anybody. So I just give you an example. There was a Denmark football player who had a cardiac arrest on the field a few months back, and we all saw that he was given a very effective CPR in the field, in the football field, and based on that, after that he was taken to a hospital and he was salvaged. He's still alive and he's again planning to come back to football. So this is an important technique which everybody should learn, and more so it should be taught to the relatives of any cardiac patient in that family. All the family members should know about it, because if there is any cardiac patient who has undergone angioplasty, who has sustained a heart attack, who has undergone bypass surgery, those persons, they remain always vulnerable to some extent for a cardiac arrest. As per data, I think I like to narrate here that 60 to 80% of cardiac arrests are usually witnessed by somebody. So it happens either in a family, in a house where other family members are there, or in a public area. But then irony is that only only 10 to 20% of these cardiac arrests are actually given a CPR. So there is still a wide lag, where 60 to 70% of people who are going through cardiac arrest, they are surrounded by people and nobody is coming forward to give an effective CPR. Where we know that given an effective CPR to a patient who has a cardiac arrest, the life can be salvaged. The technique, my colleagues have given some explanation about it. So it has to be effective. Patient should be taken on a hard surface, either a road or a floor, and then effective compressions with a fist like this should be done over the chest very fast and continue until some help, some ambulance arrives. This can actually salvage a life, and we have done it in many contexts, whether it is an emergency of a hospital. And I was traveling in a train and there somebody had a cardiac arrest and I could salvage a life giving a CPR in a aisle of the train. So this is a very effective technique. There is no doubt that there should be more awareness, and I am highly grateful to your program because you are actually trying to disseminate this message of CPR and other techniques to save a life through your program.
Well, there's a weird myth that if you don't eat meat, you don't need to worry about heart disease. Is there any truth to that? What's the fact? Dr. Kapoor.
Yeah, so this is again interesting that, there are many foods which definitely enhance the risks of heart disease, and red meat is one of them. So red meat has very unfavorable cholesterol or fats in the meat itself. So that leads to genesis of a blockage inside the arteries very fast, and that leads to heart disease and more predisposition for heart attacks. So red meat is definitely no, and we tell all our patients to avoid red meat, and as they are heart unhealthy. But I would go a stretch forward. I won't say even the white meat like chicken is very good, because most of the times in Indian kitchens we cook a meat as a deep frying thing. Deep frying is one method which is very popular in Indian kitchen, and deep frying itself is heart unhealthy. So overconsumption of deep fried chicken is also not good. Yes, grilled or barbecued white meat is better than red meat, but red meat is absolutely no and should be contraindicated in all heart patients. Now that doesn't mean that other foods are not other foods are also harmful. Even as I mentioned, the deep fried vegetarian stuff, more consumption of sweet stuff, more carbohydrates, they are also not considered heart healthy. The processed food which has more carbohydrates are the nemesis of any diet. So we should be really careful, not only with red meat but also with other food items like deep fried items. Now all deep fried items are enriched with trans fatty acids. Trans fatty acids are big villain for heart disease. They have maximum predisposition of adhering to inside the coronary vessels and causing the blockages and leading on to anginas and heart attacks. So we have to be careful. Now on the contrary, there are healthy foods like salads are very healthy, fruits are very healthy, nuts, almonds and walnuts are considered rich in good fats. They are also considered heart healthy. So there should be a good balance. We should be taking more of healthy stuff and restricting unhealthy stuff like red meat and the fried vegetarian diet.